Hi, I'm Dave Wieber from Wieber Physical Therapy,
I'm Casey.
and she's going to help me discuss some of the things in the upper cervical spine and head that we see at the clinic here. One of our very common diagnoses is headache, neck pain, migraines, and we can deal with a lot of those here at the clinic. The areas that we're very successful at are problems that occur when people come in. They say, my neck is painful in the upper cervical, or I get a headache that starts in the back of my head, or I get a headache that comes up to the top of my head. Those we really can make nice changes at very quickly. When people come in and they say, I've got sinus pain, forehead pain, some of that's not as easy for us to treat, and many times isn't a musculoskeletal problem. So when we do see the people coming in with that sort of a symptom, when we can affect the upper cervical spine from C3 or the third cervical vertebrae up through the second and first, and affect the skull on the first vertebrae, we can make really nice changes and usually fairly quickly. And I just wanted to show you some of the things that we do here at the clinic. Ready, Casey? I'm going to have you lie down. In the clinic, we would assess how she's moving in the upper cervical spine, and the easiest way to look at motion between C1 and C2, which is the first and second vertebrae, go to full flexion and then go to rotation on that axis and see what the limit is, rotation the other way. So Casey's just got a little teeny bit of restriction left, but not a big deal. That would be considered normal. You can also look at what's happening between the skull and C1 by just nodding the head in any direction. So I would then nod her and check motion between the skull and the first cervical vertebrae. Then to move those segments, there's many ways to do it. And what I like to do is block the transverse process of C2 and work on rotating C1 and C2 by using the skull and then just going over and doing contract relax. So I'd say, Casey, gently, look to your right. And I'd stop her there for about 4 or 5 seconds, and then now look left. And I'd have her lead into that space. I'm still blocking in the back, and so we're getting a nice stretch in between those vertebrae. So we do 4 or 5 of those and gain the range that she needs to have to the left. We can also do some nodding, where we do a sustained hold just as I did the test, or I could block with my finger, again at C2, and create a little pressure towards my finger, and that would move the occiput past C1. So really, those top 3 joints are what creates most of the trouble in the back of the head as far as mechanics. There's also some fascial tension, and that happens with the musculature attaching to the base of the skull. And so gentle stretch to the base of the skull can feel exceptionally good. And so we call it a nuchal release because that's the area of the skull. And so we'll hang onto the skull and just very gently create a longitudinal traction, and she will feel that kind of sliding down her back and sometimes all the way down to her tailbone. Can you feel it?
Mm-hmm.
Is it comfortable?
Yeah.
So most people enjoy it. It's a very comfortable little stretch. So you can do it that way. You can do some fascial work through the skull by just creating a nice glide of the fascia up through the sides of the skull. And again, pretty darn relaxing. So, things that I could teach Casey would be to move her upper cervical spine with some nodding or some rotation, and I'll show you 2 ways that we do that in the clinic. I'm going to have you sit up, Casey. So C1-2 we can rotate by using a towel, and if she can place it on the back of her head and rotate one way and do some contract relax, I'll show you what that looks like. So Casey's watched us do this and help people do this many times. So we take the towel, we put it behind our head at the very base, we drop one side down, and then we crisscross hands and turn and have the towel come across our upper lip, and then we can hold it there for 5 seconds, then turn and relax. And let's have you try that, Casey. A dish towel really works the best because it's lighter and thinner. Just like that, and then you turn, 5-second hold, 3, 4, 5, and then turn back, 5-second hold, 3, 4, 5, and you might do 5 different sessions of that, and back, and you'll feel a nice stretch through here. The other thing that we find, you can relax, Casey, thanks, is the musculature that holds that fascia up on the head is all the way through this shoulder. So levator scapula comes off the top of that scapula. The scalene muscles in the upper trap, they're all very strong muscles that attach to the skull here. So, levator actually attaches to the middle of the cervical, but they all attach in this region. With that, I can have Casey stretch all those in a very simple way. So I'm going to have you take that towel, throw it over your shoulder, and sit on the back edge under your butt. Good. Then, I'm going to have her move in multiple planes of motion. That'll stretch different parts of that. So if she goes straight sideways, she'll stretch the anterior and middle scalenes. If she goes forward, she'll get the posterior scalene. She can get the upper trap. And if she goes way forward, she can get that levator scapula. And so I'll have people stop in all those positions. So I'll say, okay, Casey, start up here, stick out your chest, shoulders back, nice, and then tip straight over, and can you feel that here?
Mm-hmm.
And then I'll have her hold that for 30 seconds. And then after she's been there and she feels like she gets a little release, I'd have her tip a little bit till she feels the next tissue, and the patient won't be able to sense that and go, yeah, I can feel another new tight spot. Can you tell?
Yes.
And so you get to that nice new tight spot and you go, I'm going to hold that and loosen that up. And then she comes forward a little bit farther. And then she can get even into that levator that comes out of that shoulder blade. And all of those would be 30-second holds or more because it feels so good.
Yeah.
Yeah. So those are some ways that you can start working at home to get rid of some of that tension in the head and hopefully keep it away. Thanks. And I'm Casey. She's Casey. No, we're Casey. I'm not sure anymore.
Okay.
Yeah.
Start over.